Hi everyone, I'm Lauren from Reason to Roam. It sounds so weird to say that because this is our first video, first major blog post really that this video is corresponding to. And today I wanted to talk to you about my experience at Mayo Clinic. A little weird for the first one because I haven't had an experience yet. I am going in 2 days for an appointment on July 31st, 2017. And I wanted to make this video because when I realized that, okay, I have to go to Mayo, things are getting kind of out of hand, I looked online for other people's experiences. Mayo Clinic itself has a lot of patient videos, but there is some adaptivity to that, and I wanted something raw and authentic from someone my age who maybe had similar illnesses to me, and there were only maybe 2 out there. But not exactly what I was looking for, and since I couldn't find it, I figured I would create it for anyone else who is thinking about going to Mayo Clinic, is going to Mayo, has gone, has to go back, just so you guys can kind of get an idea of what it is like being at Mayo for a full clinical evaluation. So I guess to start with a little background about me, I am 18 years old. I'm going to be going off to college in 3 weeks, so very happy I got this appointment before I had to leave. And I have been sick for about 2.5 years. I have Ehlers-Danlos syndrome, type 3 hypermobility, which basically means the collagen that makes up my joints is defective, and instead of holding my joints in place like this, is very loose, allowing for subluxations, which is a partial dislocation, or an actual dislocation where the joint comes completely out of socket. I also have postural orthostatic tachycardia syndrome, or POTS, which is what we usually call it, and that is a dysfunction in the autonomic nervous system that doesn't allow blood flow to regulate correctly, and I have frequent dizziness, pre-fainting spells. I drink so much water, so much salt, it doesn't raise my blood pressure, my heart rate gets really high, so managing all of that has been kind of tough, and I was fortunate enough to get those diagnoses very quickly. Really, in reality, there are some rare disease patients who go years searching for answers and wasting so much time and money, completely miserable because they don't know what's wrong with them. But I actually got both of those diagnoses, I think, within the first year and a half of being sick, which I count as a win. I know not everyone has it that easy, and it's hard. So I have those diagnoses, and I am going to Mayo Clinic for a new set of symptoms that my numerous specialists, I think I have about 10 or 11 right now, no one could really nail it. And we respect these physicians. They have worked so hard with my care. They diagnosed me with other things and have been overseeing the care of those diseases for the past 2.5 years. It's just a new set of problems that no one can really figure out, so we're like, let's get a fresh set of eyes, let's take it to Mayo. But how did we really find out that Mayo was the right choice? Really what had happened was I took my new set of symptoms to my primary care physician after about 6 months of experiencing the symptoms, which I will explain in a second, and I told her this is the only thing I want to talk about in this appointment. No one has been able to figure it out, and we just want to bury it and nail it down right now before I go off to school, get proper treatment. And she said, after we explained the other things that I had been tested for regarding these symptoms, that there was really nothing she could think of. She was kind of stumped. My specialists were stumped, so she said, you know what, maybe it's time to go to Mayo. And that was a very clear and direct way of knowing that we had to book an appointment and get on over to Minnesota. So what's going on? Why am I going? My symptoms have been primarily postprandial or after eating, in which I'm experiencing fatigue, extreme fatigue, a high heart rate, low blood pressure, extreme dizziness, confusion, can't concentrate, and if it really gets bad, I'll have blurred vision too. The fatigue becomes so extreme that I was almost falling asleep in school. If I'm home, I do fall asleep and I wake up feeling worse. And it doesn't matter what I'm eating, how much I'm eating, when I'm eating. There's no correlation to the onset of symptoms. We've ruled out allergy problems, also blood sugar problems. That has all come back normal. So we're really trying to figure out why is it so random. The randomness is what's stumping people, because if it was an allergy, it would be the same thing every single time. If it was blood pooling in my stomach from POTS, which is common, it would happen every single time, or every single time I have a bad POTS flare, and that's just not the case. So we're hoping at Mayo Clinic they'll be able to evaluate me, hopefully with gastroenterology, which is what it seems that this is stemming from based on conversations with my doctors, and we'll be able to get to the bottom of it. So how did I get into Mayo Clinic? Well, the first thing we did was call. That's kind of the first step. You got to talk to them. And they had told me, after I explained my symptoms and my other diagnoses, they said, okay, I called mid or early June, I will put that out there. And she said, we are booking into late August, and our scheduling is about 3 or 4 weeks behind, so wait, and we will call you if and when we can offer you an appointment. So we waited, and around end of June, maybe beginning of July, we got the call saying, hey, you have been accepted for an appointment, and we would like to see you at our office for initial evaluation on July 31st. Okay, so how did we prep for Mayo? First, when I got my appointment, I made sure to call my primary care doctor and let her know, hey, this was my appointment time, because she was the one who referred me. And then I went about collecting all of the medical history that I have accumulated in the past 2.5 years. Unfortunately, I don't really have anything prior to that because we've moved a few times and it kind of gets lost in the mix of moving. But I do have everything in this little accordion briefcase binder. So it's kind of cute. It just unbuckles like this, and then in the front, I kind of organized it based on what would be most important and what I want to put in Mayo Clinic's hands immediately, and what I want to hold on to if they ask for it. If they want to do some testing, I can show them what has already been done. So I have Mayo Clinic's actual paperwork in the front, followed by the cover letter from my primary care doctor, initial evaluations for my EDS and POTS that actually declare the diagnosis, or diagnoses, and my medication list. And then I have blood work. I included my most two recent comprehensive metabolic panels and CBCs. And then imaging, which is mostly MRIs of my back. PT notes, because they did book an appointment for PT on my second day, so I'm sure the PT will want to see that. And then I have hospitalizations. There was actually only one from 2013. I had an allergic reaction in the hospital, and I just want them to have those notes in case they try to give me the dye that I had the allergic reaction to. I also have genetic testing in here. I had testing done to see how I metabolize different drugs so that my doctors could best prescribe the medicine that would work well for me. And then I have other testing, which includes autonomic testing and a 24-hour urinalysis, which was testing for catecholamines. And then I have a huge chunk, I don't know if you can see how much this is, of specialist visit notes. So from my 10 other doctors besides my primary care, she was able to print out the most recent visit note that they had sent her, or I guess letter to MD, which will hopefully best assist Mayo with prepping and seeing what has already been taken care of and what the doctors couldn't really figure out here. I do want to quickly add what I know going into Mayo, because they really don't tell you a lot, unfortunately. It's just kind of, this is your appointment time and this is where it is. A few tips that I think are going to be helpful is I did download the app, the Mayo Clinic app, so my schedule as far as where I need to be and what I need to bring is all on my phone, so I don't have to worry about all the paperwork they're going to give me. It also will show you your lab results as soon as they come in, which is helpful just so you can get your eyes on them as soon as possible and not wait till your next appointment. I do have a few pamphlets that they send in the mail. So I've gotten, I believe, 2, maybe 3 packages from Mayo. The first one was kind of an introductory patient's guide. They gave us a lodging pamphlet with all these hotels that Mayo Clinic is close to, or some of them are even affiliated with Mayo Clinic. And if you bring in paperwork saying that you are a Mayo patient, you will get a discounted rate. I think it's usually like 5 to 15%, but it does count in the scheme of things. And then I have a patient's guide to Mayo Clinic, and this kind of shows you it's just more of like welcome information, what they're about. And then campus maps, which is obviously going to be helpful when we are walking around the hospital. So what they've told me specifically is my first internist appointment, which is the first day I get there, and that's the only appointment I have booked currently for the first day, and then I have 2 appointments on the second day, one of them being PT, and I have another appointment that they did book for August 24th, which I was a little concerned about because Mayo tells you up front that they're going to keep you for roughly 5 to 7 business days, depending upon availability and the complexity of your medical case. 24th, if I'm going on the 31st of July, is a month away almost, and I'm going to be taking classes at my university at that time, so I told them, I cannot make that appointment. Is there any way you can get me in sooner for that specialist, which is ironically gastroenterology and hematology, which is the doctor or subspecialty that I really, really need to see. And they told me that they are calling that department every single day up until my appointment to see if there's any cancellation or if they can book overtime. And they did say, if not, there is some way for me to see someone. I don't really know what that means, but when I do, I will tell you guys in the next video. So that kind of concludes my introduction for what brought me to Mayo Clinic, or what is going to bring me to Mayo Clinic this weekend. I will see you guys in the next video at Mayo Clinic. I do plan to vlog my experience more in the hotel room than out and about, because I don't know if I want to bring this huge camera with me, but just updating you guys before and after appointments, and I will see you then. Thanks for watching.